Gentlemen, welcome to Stuck in Middle Podcast. I'm one of your hosts, Reflex. My co-host, AK, is not in the building today. He's out handling some business, but I definitely appreciate you guys checking this podcast out weekly. We definitely appreciate you. That's SITM Podcast on all social media platforms. If you want to connect more with us, send us an email, sitmpodcast237 at gmail.com. Questions, concerns, and referrals. We'd love to hear from you. Definitely want to remind you this podcast is sponsored by Perfect Office Solution, providing affordable, professional, flexible private office space starting at just $4.99. So if you let them know we sent you, use promo code SITM Podcast, you get 10% off. That's a good deal. Now, I got a guest in the building that I'm very excited about. We are very excited about this podcast because you actually reach out to us. We love that. Dr. Degha Fongod, CEO and founder of Delight Primary Care, is in the building. Welcome to Stuck in the Middle Podcast, Dr. D.
Thank you so much for having me. I really appreciate this opportunity to let you guys know what I do.
Yeah. Now we appreciate you coming through all the way from Fairfax. That's a hike.
Yes,
That's a
absolutely.
hike. Now I want to start somewhere. That kind of like break the ice a little bit. You call yourself an internist.
Mm-hmm.
In medical terms, what is that? What does that mean?
So that means that I specialize in internal medicine. So normally when everybody goes to medical school, that's a 4-year process. And then I chose a specialty called internal medicine, which is a 3-year residency. And it's specific to studying medical medicine for adults only. So I specialize in adults 18 and above. I'm more of a diagnostician. So when someone comes with an issue, I'm going to try to figure out what's going on with them, and I am well versed in all organs, which is like internal organs, right? Mm-hmm. So from cardiology all the way to rheumatology and everything in between. I can break that down later.
Yeah. I bet like when you first tell people you're an internist, they'll have no idea what that is. Because I did.
So it's interesting. When I say internist, some people are like, oh, you're an intern. I'm like, no.
Exactly.
I'm not an intern. I'm an internist. I specialize in an internal part of your body.
Mm-hmm. Okay, makes sense.
That's pretty much where that comes from.
Why did you choose the medical field, Because, like Stuck in Real Podcast, we always, the tagline is, we coming up from an African home is you either be a doctor, engineer, a lawyer, you're a disgrace. These are the fields, right, that you get chosen. You actually are walking in that path. So your parents must be proud.
Yes, they are proud. But my reasons are not the typical reasons. So I grew up I was born here and I grew up in Cameroon and I have asthma. And so when I was growing up in Cameroon, I got sick a lot. And I was always in the hospital. And so I was very comfortable in a hospital setting. So it only made sense for me to kind of follow that path. It wasn't any pressure from family or anything like that. So I just naturally liked the hospital because I was always there. And as I got older, I realized that in Cameroon, we don't have preventative medicine. So that was something that I wanted to focus on. I wanted to make sure that we had the opportunity to prevent diseases from getting to the point where you need to come to the hospital, which is what always happened to me.
Mm-hmm. Now you speak of your excitement when you finished medical school to get in the field and to get your foot wet and start helping patients. That's what that's what I really appreciate about doctors is the excitement to help patients. But you also say you were derailed by some of the cracks in the healthcare system.
Yes. So that's a bit complex, but I'll give you an example. So when I finished residency, I started a job in Louisiana. And when I was there, I had to see up to 14 patients a day.
Whoa.
And that isn't optimal for a patient.
Is that like mandatory? Like they give you like a quota or?
So it's not mandatory. So the way you basically get paid based on how many patients you see. Technically. So if you don't see the number of patients that they tell you to see, then you can get a pay cut.
And that's from insurance?
No. That's not from insurance. That's from whoever employs you.
Wow.
Usually like a hospital system.
So like a Holy Cross or Kaiser kind of thing.
Something like that.
Yeah.
But yeah, so you sign a contract and they tell you how many hours that you need to work, and those hours transfer to how many patients you have to see. So the average doctor who works with an insurance model has to see up to 25, sometimes even up to 40 patients a day. So imagine how many minutes you would spend with a patient, like sometimes 5 to 7 minutes, and you cannot practice good medicine that way.
Wow. How did that make you feel?
It was horrible. It was, I mean, I spent 11 years in school. 11 years in school, and I thought I had my dream job, and then I start working and I'm in this model that is not acceptable to me. I'm not giving the kind of care that I want to give. So it didn't sit well with me. So I decided that I was going to try to look for other options. And that's how I ended up
So
here.
they don't teach that in school because you didn't find out till you got in the field.
No, no, they don't teach it in school. I mean, when I was doing rotations in offices, I would see a lot of doctors. They were complaining about the system, but they were just working with it, and they never looked for other alternatives. So I thought I just needed to go work and do whatever everybody else was doing, and I'll figure it out. But once I got in there, I did not like what I saw.
So like, what else did they not teach you in school that you find out kind of like in the field?
A few things. So one, they don't teach you business, right? So when I was working with a partner, she had her own practice, and she had instructed her practice in a good way. So she was in a lot of financial, like not debt, but she was struggling financially, and as a result, she had to sell her practice to a hospital system, and then the hospital system would then pay her to see patients. So I identified that to be like a major issue. You know, if you have some background in business, then you know what kind of decisions to make in the business field. They don't teach you billing, they don't teach you coding. You have to hire somebody to do all of those things,
Man.
and that costs money, right?
Yeah. Wow. We've kind of like gotten so deep into it.
I know.
I want to take a little step back
Okay.
and get to know you. You were born in Cameroon, here in the DC area,
I was born in DC. Yeah.
and you spent some time in Cameroon.
Yeah, I was there for 12 years from age 3 to 15.
Was it by your choice, or you were a bad kid? It was like, we're shipping you back home.
No, my mom was a single mom and she was going to school, so it was a little difficult for her to juggle the two. So she sent me to be raised by my grandparents.
And how was that? How was that experience?
It was an amazing experience. I mean, I speak my dialect, for example. I understand my culture really well. I have a connection with my tribe, and I'm also American, and I have Western ways of doing things. So it's like I have two lives, you know.
What part of Cameroon is it?
Balinyonga.
Okay. When did you come back here?
I came back in 2002 when I was 15, and then I went to high school in DC.
No. Okay. So and then you graduated from what institution? As far as
I
like your medical school.
So I did college at Juniata College, which is in Pennsylvania, and then I went to Ross Medical School in Dominica for medical school.
You married?
Sorry?
Are you married?
Am I married?
Yeah.
Yes, I am.
Is it true that doctors only marry doctors?
No, my husband is not a doctor.
Because I hear that a lot. It's like doctors like to marry doctors, like lawyers and whatever. But
I mean, it could be easier because, if you're always with the same type
Yeah.
of people, it makes sense. But no,
all right, congratulations.
thank you.
Now so like by virtue of the topic being healthcare, it tends to get political, and being that we live in the United States, it's a lot of issues around healthcare. What are some like political issues that affect the healthcare that we experience as citizens in this country that you see?
So for me, I think the main issue is the insurance model. So typically, insurance is insurance. It's supposed to be there to help you if you have something bad happen, like a catastrophe, for example. I'll give you an example of car insurance, right? When you use your car insurance when you have an accident, for example, when something bad happens. When you have to change your tires or change your oil, nobody, they don't bother you. You pay out of pocket for that. So in our system, I'm a primary care doctor, and I'm like the maintenance person of your health, right? But unfortunately, the insurance companies have kind of dipped their hands into our part of doing things, where they dictate how we get paid for maintenance when they shouldn't. And as a result, the prices get they jack up their prices, and that ends up costing people a lot of money. Now you can scale that all the way up to the government, lobbyists, things like that. So it's kind of all a money making machine, unfortunately, at the expense of people's health.
Now you practice what you call your practice is not insurance based.
No, it's not. It's cash based.
So okay, so break that down further.
So the way I practice, people who come to me, I charge them a membership fee, and in return, I take care of their primary care needs. I just keep it simple. You pay me for services. If you're happy, you keep paying me. If you're not happy, you stop paying me. And I basically took the middleman out, which is the insurance company, because they dictate a lot of things that I have to do that is not beneficial for the patient.
Now, it sounds like it's great, a great benefit for people like me who are uninsured.
Yes, absolutely. You shouldn't. I mean,
I just put myself out there. I'm like, your Men Crush Monday don't got insurance. It's coming up in 2 years, man.
yes.
God, I know I get sick. Oh, if I get sick, I'm just come straight to you.
No. It is a good option for people who don't have insurance. Absolutely. I don't preach not having insurance, but if
It's
you
not
don't,
by choice, though.
but if you don't have insurance, you have an option, right? Just because you don't have insurance doesn't mean that you shouldn't get great care.
Which is why I'm like, this is like, I didn't know about this.
Absolutely. And there's a lot of doctors around the country doing this as well. So at the end, I'll tell you how other people who are listening can find out, and they can look for doctors in their local area who are doing
I like
this.
you're not like, oh, just come to me. You're looking out for that doctor.
Yeah.
So why the name Delight Primary Care by Dr. Fun God, Dr. D?
Yeah, so I wanted to pick a name that reflected how I would want to feel when I am talking about medicine or when I am practicing medicine.
Yeah.
And I want to be happy, okay? If you meet many doctors, they're miserable. And so I wanted to be delighted about what I'm talking about. And so I figured delight, and plus I'm D, so, it just worked together.
Yeah, I like it. Now, can people have both? As far as like, can I have the normal insurance base from like my job and also have primary?
And also see me?
Yeah,
Yes.
like a doctor like you.
Yeah, so I actually have patients who have insurance who come to see me. So if you have, for example, a PPO plan, let's say Blue.
What's PPO?
Uh,
Pay per
no.
observer.
That's it's like a private. Anyway.
Oh yeah, medical term. We'll
Leave that one alone. But basically, the PPO plan is a type of plan where you're allowed to see doctors outside of the network that you have. So let me give you a little lingo. So there's HMO and there's PPO. HMO is something like, let me see, United Healthcare, for example. That insurance only wants its patients to see doctors who are contracted with them. You cannot go outside of the system to see doctors. If you do, they penalize you very significantly. A PPO doesn't do that. They say, you can pay us, you can go see whoever you want. So I have people who have PPO plans because they can come see me and their insurance is not going to bother them about seeing me. So either you have insurance or you don't, I'm still a good option. And for people who have a lot of medical problems and 5 minutes isn't enough to address those problems, then they say, you know what, you can come see me because I'll do 30 to 90-minute visits based on your issues.
Are there other options other than the two?
So you have Medicaid depending on your how much money you make, and then you have Medicare for the elderly. So those are like your options, basically.
Medicaid.
Actually, there's other options too. So there's something called the health savings plan. If you're Christian, there's a Christian health savings plan. What they do is that you pay a monthly fee into a pool, and basically you can use that to pay for your health insurance, for your health insurance, basically. Yeah. So if you end up in the hospital, they'll pay for it cash. So that's also another option.
Now, how long have you been doing Delight Primary Care?
So I've been doing it since January of this year.
Wow. Yeah. And are you enjoying it? You like looking back or?
Yeah, I am enjoying it. It is tough because it's a new concept. So I have.
Really?
Yeah, so it's a new concept.
Like nationally or for you?
For people in this area. And let me put it this way. Like, for example, you didn't know about it, right?
Facts, yeah.
So I have to go out and educate people about it. And then once I educate them, then I can get them to come into the door. So a lot of what I've had to do is more education. But now I'm starting to see a turnover where people are starting to come in to see me.
Business is growing.
It's coming.
Yeah, doing good.
I'm trying.
Congratulations. Now, why if an insurance company approached you, and they put, I don't know, cash, big old cash on the table, would you? I don't know if that's a
No,
thing.
because that means I'm gonna become their slave again. No,
So you're like, nah,
no.
you're not looking
I'm
back.
free. You break free, so you don't want to go back into chains, right?
Now, what in addition to the number of patients you see a day, what other restrictions do insurance companies put on doctors
So,
in the typical healthcare system that we have right now?
for example, if a patient needs, let's say a patient needs a CAT scan, they are going to want us to do pre-authorization forms. And some of these forms can take up to an hour, which you don't get paid for, by the way. You do these forms, you send them, and sometimes they can reject it. So now you're delaying care for the patient just because you want some form and, things like that. So, something like that. That would be like a good example of what insurance. And then also they have something called, for example, there's something called MACRA. Basically, it's a way that they try to see if doctors are performing properly, and they make you do all this paperwork, which again doesn't benefit the patient, but we have to do this paperwork because we're contracted with them. So it's just not advantageous for us.
What's the good part about the normal insurance model or hospital model? Let's just throw that out there for people who are like, oh,
you get a nice fat paycheck.
Oh, I'm talking about that's for the doctors.
That's for the doctors.
For the patients.
For the patient, the good thing is that if something bad happens, you're gonna get covered, and you need insurance, right? I'm not advocating that you don't get insurance. I'm advocating that you get insurance that's appropriate for you.
Okay.
So if you get into a car accident, like God forbid, it's gonna cost thousands of dollars, and you need that cushion to take care of you during that time period. So you need insurance. It's just you don't need the insurance doesn't need to do everything that it's trying to do.
Now, in the normal insurance-based system, you pay monthly. Do your job or whatever. You don't see a doctor maybe twice a year, at best, maybe more if you're sick. In your model or in this model, do I pay monthly or is it that I pay only when I come to see you?
So you pay monthly, right? Because I'm making a salary off of what you're paying me. There's nobody else paying me. I'm not getting any contracts or anything. So you're paying me monthly for access to me all the time. That's email, that's text. You can call me, things like that. So if you have access to me all the time, and I help you get discounted meds, I help you get discounted labs, I help you get discounted radiology, imaging. So
okay.
You're not just paying for the visit, you're paying for my expertise in so many different things. You're paying me to save you money through healthcare.
If I'm trying to get out of work for a couple of days, you can write doctor's note too.
I don't know about that. We'll have to talk about that later.
I just had to ask. But let me play devil's advocate real quick. Let's say you get, because you mentioned having to see 14 patients a day and, the burden of that. Let's say the light primary care grows so big, it's like, dog, you got to go see Dr. D. You got to go see Dr. D. You got to go see Dr. D. You got, what I'm saying? Now you got a whole bunch of patients and, you're like, dang, I only got so much time. How do you handle such a thing like that?
I'm planning to cap myself at 400 patients total. The way I set it up, if I'm going to promise you 30 to 90 minutes a visit, there's no way I can see that many patients. So if things blow up, then I will find other doctors who follow the same model, and you can see those doctors as well. So, people can come, and there's doctors who would absolutely love to practice in the same way that I'm practicing. So if it blows up, we'll just get more doctors and you get more time.
I bet make it blow up. So in that same vein, you can plug in. You mentioned later down you're going to talk about other doctors who do the same thing as you do. Yeah.
So I'll give you a website. I could give it to you now or at the end. It's called dpcfrontier.com/mapper. And at that page, it's a map of the entire country. And depending on which part of the country you are, you can find doctors who are doing the same type of model that I'm doing as well.
Okay. I hope people got that. Now, how do you respond to the argument that doctors are more and this is how I believe. I'm just going to put that out there. Doctors are more interested in selling you medication than actually, getting a chance to know, like, what you're going through and try to heal you, cure you. You know what I'm saying? They're just like, oh, go take some,
Yeah. I think that's
because pharma is big business.
Yes, pharmaceuticals is a big business. So this is also part of the system setup, right? So if a doctor doesn't have enough time to see a patient, the tendency is that they're going to give you a medication to, try to patch things without taking time to get to know what's going on. But because I have time, I'm not interested in giving you medication unless it's absolutely necessary. So that's another advantage of the way I'm practicing. Because I have time, I really get to figure out the root cause of what's going on, and I'm not just pushing pills and sending you out of the door.
Okay, okay. I like that. Now, it's Labor Day weekend, and you got an event coming up.
Yes.
You want to plug that in?
Yeah, sure. So I decided to give out free physicals at my location for Labor Day. So we have Monday, tomorrow and Friday this week. And actually, the event is fully booked at this point.
Where's it going to be at?
It's going to be at my office.
You just mentioned
Yeah,
that.
it's going to be in my office. I can, the address is 3022, what is it? Javier Road, Suite 105E, Fairfax, Virginia. So the event is booked out actually. So I actually opened up the second week. So the following week, that's September 10th and September 14th, we have a few spots available for free physicals.
Okay, that's nice. Pull up to Dr. D's office, get you a free physical, you know what I'm saying? That's a Labor Day weekend. I know you might be off the job. Or even though you can't make it Labor Day weekend, the address, you just said it. Go, even just to go talk, find out what she's about. I'm sure she got business cards in the lobby. Just pick it up, or you can contact her through this podcast and find out more. Now, you went from, as you describe it in your own words, having a job in Louisiana to not having a job. So like, man, screw it, I'm starting my own thing.
Yeah, well, it wasn't so simple.
Which is going to my question: would you advise people to do it?
Yes and no. I would say no if you know that you don't have the guts to because this is not just opening your practice, right? This is opening a business. And like I said earlier, most people in my field don't get any business background. So if you know that you're not going to be able to do that and you're not going to be able to take a risk like that, then maybe it's not for you. I mean, and there's other options for people, who you can work for an employer who's actually treating you well. There's so many different options. But if you have an idea of how you want to practice and you are willing to risk, the financial security that comes with being an employed physician and, start your own thing, I think it pays off in the long run. But if you have the guts to do that, then absolutely you should go ahead and do this.
Now,
Plus, I get satisfaction from it.
Yeah, I bet you do. You get so much delight from speaking about it, hands and knee. And this is a typical stuck in the middle question, but I have to ask. You've been, like you said, since January, that Delight Primary Care has been in. What have been some of the struggles? Both from a business standpoint, a family, personal standpoint.
Yeah.
And how have you been able to overcome those?
So, like I said, my biggest struggle actually was educating people because I set up the practice, I was a bit naive, and when everything was ready, I was like, where do you get the patients from? So I didn't know how to do any of that. So I had to end up doing a lot of networking in the area and trying to get the word out. So that was a little bit difficult. And I was actually pregnant at the time. So that was quite...
Strong woman. Wonderful.
That was a lot, going to networking meetings. I was 7, 8, 9 months pregnant all the way. I worked all the way till like 2 weeks before. So that was a little bit of a struggle. And then once I had the baby, I had, postpartum issues and I'm not sleeping and I still have patients to see. So again, it's been a struggle. I won't lie and say that it's been easy, but you just have to do what you have to do.
Hey, I want to give a shout out to the baby. She's in the studio today, by the way. She's so pretty. Now, I want to ask you this question too. Were you talking to people? You mentioned, but were you talking to other doctors? I don't know, in your experience, and do like, man, I'm about to bail out and do similar thing, or was that a trend? Is that a trend now?
No, a lot of doctors, like a lot of my colleagues, they're comfortable. They'll complain to me about what they're going through and how they're not having enough time with their family and they feel overworked. But I guess once you bite that money, it's really difficult to let go. It's a huge risk for people to take. So, what I have is I have time with my family and I'm pretty happy, and I may not be making as much money as them, but to me, that's more valuable. But on the flip side, they have the money, and I'm not gonna lie, we all have student loans. I just put mine on hold until things get better. So if you have a family and you have to support them, then you don't feel like, you're not going to want to take that kind of risk, right? Where you don't know if it's guaranteed if you're going to be able to generate an income. So yeah, it's a tricky situation.
Yeah. Now, being that you're African, you spent some time in Africa. I don't know when the last time is when you were down there or when you planned to go.
Last year.
Whatever. Okay.
I go often.
That's good. So how do you see the healthcare, industry in Africa? Just you say focus on Cameroon, for example.
That's a loaded question. It's
I know it's a vague, broad question.
It's so vague and so broad, but to me, it's not good. Like I said, one of the issues that I identified when I was growing up was that there wasn't any preventative care. So you see a lot of people dying back home, and they die from things that you could have found a lot sooner and you could have treated. But because we don't have that culture of going to the doctors to just check on things once in a while, so many things get missed, or when they do get found, it's too late, and then, or people just all of a sudden die, right? And they're like, oh, it's Miongo, oh, it's, whatever. But it could just be that it was something that could have been prevented.
Right.
So that's generally one of the major issues. And also the fact that you need money to see a doctor, that really bothers me. Because what if you don't have money? Then you're kind of, you're in trouble. You're not going to get the care that you need. So I'm hoping that when everything settles down in our country, maybe the country will try, the government will try to improve the healthcare system and try to.
That's a serious hope, my sister.
Listen, everything starts from dreams and hopes. Okay,
exactly. The life primary care started from dreams and hope. I'm
exactly.
Sure. How easy would it be to implement such a system as yours in Cameroon, for example?
I think it might be a little bit difficult. Well, it might be easy because people are already used to paying for medical services.
As soon as I asked the question, you know what came to my mind? Somebody just come and see Dr. D. I beg just help me. I'll come pay you later. And then like that. Next thing you out of business. Oh, that's a baby, so pretty.
Whoops. Yeah, so I could see that happening, and then doctors not getting paid, right? And I know that sometimes in Cameroon, doctors end up having to find other ways of substituting the income because they don't get paid well, and they do a lot.
So would the insurance system be more beneficial to start with in Africa?
Yeah, I think an insurance system would be really helpful. But as long as they learn from America's mistakes and don't implement the same type of insurance,
like codes and stuff.
Exactly. I think it will be much better. And if they can make the insurance system only for catastrophes, like I said, and people just have to pay for general follow-up. If, for example, if you had to go see a doctor for 2,000 francs and you would get a physical and once or twice a year, that's good, right? I think people can, well, depending on where you are, you can afford that. And then your insurance would then cover something major like, a car accident or cancer or something like that. So I think that's something that could be implemented back home.
Okay. I got to ask you this question. I don't know if you're ready for it.
Oh, well.
Is healthcare, we coming back to America now. Is healthcare a right?
In America?
Yes.
No, it's driven by big business. It's driven by pharmaceutical companies. It's not focused on the person. It's not focused on individuals. So unfortunately, people are just numbers in that setting. I think the intention was good in the beginning. I mean, insurance models started, I believe, in the 50s and the 60s, but what it is now is not what it was when it was started. Yeah. Okay.
I'm learning a lot. Now, if we were to turn back the clock, and given different circumstances, fresh out of school, having working like you did in Louisiana, would you have started the light primary care?
Absolutely. If I knew about it when I was in residency, I would have started sooner.
Even if things were good?
Because like I said, when I was doing my rotations, a lot of my professors were complaining about the system. So it's not like I didn't know what was going on. I just thought they're older I'm young, so I can work hard, right? And we're Africans, we're taught to work hard, so I figured that would be the solution to the problem. I didn't really realize how that was going to impact the patient. So if I had known, yes, I would have started sooner. I would have done more research. I would have prepared a lot more. And a lot of people are starting to do that right now.
Okay. Yeah. Now, what do you see Delight Primary Care in 5 years?
I mean, I'm going to be ambitious and say in 5 years, I'm hoping that I have a few doctors working for me so I can continue to provide, not just me, but other doctors can continue to provide this type of care to patients.
So there's that option to have a web kind of network,
yes,
collaboration
absolutely.
kind of thing.
Yeah, that's the plan. I can't see everybody, right? So like I said, I kept myself at 400. What if 1,200 people want to come? Then I need to get more doctors. So that's the plan.
Is there anything you wanna add to the conversation that I didn't ask?
Yeah, I mean, I'm just gonna kind of summarize, like, basically, if you're somebody who doesn't have insurance, or if you have insurance and you're just not getting great care, then it's time for you to find a doctor that can provide that care for you. Like I said, I provide 30-minute visits all the way to 90-minute visits. So, and sometimes I actually do house calls. I didn't even mention that part. So if you're really sick and you can't come to me, I'll come to you. I go to people's offices when they're sick for urgent care. I not only provide good care, I also help save you money from the healthcare perspective. So, and if, I know I've had a few people who are out of the country, who live out of the country and come in and they want to see a doctor and they don't have insurance. Well, I'm a good option for you because my prices are reasonable and I'll take care of all your needs. And I don't care that you don't have insurance as long as, you can pay me for my services.
That was a great elevator pitch right there. Delight Primary Care is the name of the business. How can people reach you?
So you could, best place with all the information is my website. So www.delightprimarycare.com. I'm also on Facebook, facebook.com/delightdoc. I'm on Instagram, delightpc. I'm on Twitter, delightpc. And actually, if you really need to talk to me, you can reach me directly at 703-879-4729, and I will answer the phone and I'll talk to you.
We're giving numbers out in this joint.
Yep.
I like it. Now, I really appreciate and learn a lot from this conversation. Really appreciate you coming and talking with us.
Thank you so much for having me.
Yeah, definitely. Hope and pray success in everything that you got going.
Thank you.
Next January, come update us. Definitely come update us on everything.
I would love that.
Hope you enjoyed the show. This is Stuck in Middle podcast. Do not forget to rate the show on all social media platforms and let us know what you think. Screenshots, links help if you share that with your friends. That's how we grow. We definitely appreciate that. That's SITM podcast on all social media platforms. If you want to talk with us, we'll not give the phone number. It's on our business card, but you can send us an email, sitmpodcast237@gmail.com, and definitely hit the web, sitmpodcast.com. And I'm Reflex, and we are out. I miss you, AK.